seemed kind of easy now that I've watched it, but it's still a battle of mine. My name is Kathy Van Riper, and February marks my 5th year of fighting metastatic breast cancer. But who do you see me as? Some of you may see me as a medical record number. But I'm hoping that you might see me as Kathy, a wife, a mother, a sister, a daughter, an aunt, a teacher, a friend, and a runner. I feel very privileged to be here representing the thousands of women that might soon have a story to tell. A story that begins with a medical record number, a time slot, and a chart. A system that is definitely necessary and makes complete sense. That system also structures patient care around things like risk factors and protocols and statistics and history. And again, without these, there would be no organization. But what happens when you've been diagnosed with cancer, with apparently no risk factors, or recent protocols don't necessarily fit into your lifestyle, or when, like all patients, you fall into the other side of statistics, the individual? How do we maintain these items, but also balance the personal side of patient care? Partnering with Catherine on her earlier slide, I thought it would be interesting to do a little research on the word touch and share how I feel it can impact patient care. Touch is the portion of care that doesn't fall under a protocol, a procedure, a policy, or a statistic. It's the part of care that's personal and where a sense of hope can be shared. Here are some of the phrases that I found when researching touch. Touch, a communicative interaction. Now, to me, something as simple as the familiar receptionist or radiology technician taking time to remember my first name opens that door to communication, and an effort and personal interaction is made. Touch, the act of putting two things together with no space. Space between a patient and a provider can be a barrier in effective care. It's a barrier that's uncomfortable and where I feel communication can be lost. And to me, that barrier becomes smaller when I feel the provider can show me that he has time to listen to me and also cares about my concerns. Touch, a discernible mark or effect left by contact with something. Now, there's no doubt in my mind that you all, as healthcare providers, are in a position to leave a definite mark on people's lives. Now, of course, that mark can certainly be positive or negative. It's been difficult to forget the initial appointment I had with an oncologist after my original diagnosis. After reading over and reviewing my pathology report, he said to me that there wasn't a lot going for me. That mark left a scar of doubt that has taken a very long time to shake off. And I'll never forget, well, I subsequently sought a second opinion, and I'll never forget that doctor when he walked into the room with my chart in his hands, and he sat down with me and my husband, and he reviewed that same pathology report, and he stated to me, "Here's what we can do." I changed oncologists. And I've seen each of my children have 8 birthdays since then. Touch. To change or improve by adding fine lines or strokes. And when I read this definition, it's easy for me to see, well, as artists, you're all artists specializing in the art of patient care, and you're looking for those opportunities to provide hope. Like when my oncology nurses sit and share a story with me, or maybe they'll ask about my kids. Or many times I'm greeted with a great big bear hug. Or the infusion center pharmacist may walk by and stop and check in and ask how I'm feeling. He doesn't have to do that. He chooses to. And I really like that. Or when my oncologist, he has the ability to read the fear in my eyes. Yet he still knows the right words to say to keep hope alive. Like the fine lines of a painting, I feel those are the strokes that make the big difference. My reasons for highlighting these phrases is to try to make a point that in seeing patients every day and seeing them under the constraints that you do, that it might be easy to lose track of the person behind the patient and the aspect of care that doesn't fit into the box. Touch. And by remembering that, you won't be pushing aside patient care protocols or stop looking at statistics. And you also won't be ignoring risk factors just because they don't always apply. But you will be factoring in the ever so important side of care, the person. Because to that person, the most important side of care might be that you know she needs to continue to run to be happy. That she has an 8-year-old and an 11-year-old and needs to be as active as possible. That she's a worrier and just needs to talk things out sometimes. And that she doesn't want to be lost in a sea of routine actions and reactions. She needs you to know that hope drives her. And she begs you to fight the routine and wants to remind you to also treat the person behind the medical record number. Thank you.